All right. Hi, everybody. So this is a virtual behavior chat, the July 2021 edition. This is vet behavior focused, and I'm just going to make a quick introduction. I'll probably mess this up already, even though I've just been corrected. So we have three people along with myself here for this vet behavior focused, all three veterinarians, all three vet behaviorists that are here to talk. So we have Dr. Laura Haug. Did I said it
Yep.
correctly this time? Perfect. We have Dr. Chris Pachel.
Very close. Pachel. Yes,
Pachel.
We're getting there. We're getting there.
I got to remember the. I'm just gonna remember the Dr. Apocalypse.
Exactly right.
There we go.
Yeah, the side story there, I was actually getting introduced at a conference, and that was the verbiage. And so the individual went up and she said, please help me welcome Dr. Pachel to the stage. And there was this dramatic pause to get in there to make sure the pronunciation was right. So if you need to do the same, I say run with it.
All right. And then Dr. Valerie Tynes. So, and I'm Eduardo Fernandez. And with that in mind, that's the extent of my introductions. So I'm gonna let any one of the three doctors here start it off. So is there any way that you all would like to get into the conversation?
I guess I would just jump in and introduce myself as, and I would love for the other two folks to do the same, just in terms of the background, right? So I work in private practice. I've worked in both house call as well as facility-based and university-based settings. So I've got a bit of experience there, but I've been in the field since I started my residency in 2004. So going on 17 years, specifically working within the vet behavior space. And I've had the great fortune of working with both of these other phenomenal clinicians throughout my entire career. So I'm grateful to be here today.
Perfect. Let's keep it going with
Valerie.
Valerie and Laura. Thank you.
I will start if you want. So you know exactly where we are all coming from, what our backgrounds are a little bit. I graduated from vet school in 1987, and I actually did about 14 years of general practice with a special interest in behavior and exotic pets. So that's kind of my little interest. And I did that before I was able to go back and do a residency. So I've been a boarded veterinary behaviorist since 2003. And like Chris, worked in private practice in a lot of different ways, house call and in a clinic setting. But about almost 7 years ago, I went to work for SIVA Animal Health. So now I work in industry and I see cases just sort of part-time.
Great. Awesome. Well, I'm going to use my intro to sort of segue us into one of the topics that we had sort of discussed previously about, just kind of giving people an introduction to veterinary behavior. I also was boarded back in 2002, and I actually, right after I was board certified, ran animal behavior service at Texas A&M Small Animal Clinic for several years, and I am now in private practice. But the way and sort of the reason I got into behavior, because I've been interested in animals my whole life. Everybody's like, oh, you're going to be a vet, right? But I started training dogs with my mother when I was 12. And so all through my entire, undergrad, college education, I was involved in different competitive dog sports. And so it was kind of a natural melding to me to then move into veterinary behavior. But our field has changed a lot over the years. And back when I did a residency, and even before that, when I was just interested in veterinary behavior, the type of behavior and, if you will, veterinary medicine, behavioral medicine that people practiced was much different. And nowadays, I'm very, very happy to see that we have made extreme advances, both in our scientific knowledge, but our skill level, and melding other disciplines. Because my experience with the Veterinary Behavior College in the beginning, it was very, very heavily ethology focused. And of course, we had a lot of limited data from wolves and stuff that we had extrapolated in, much of which we now know is, not very accurate. But there was a big dichotomy between the veterinary behavior world and the dog trainer world. And I came from the dog trainer world. Like, I got into behavior because I loved training. And so it's been nice over the generations of our boarded behaviorists to see how our diplomates now have progressed to getting more functional analysis focused, and really bringing in a lot of these scientific learning techniques, and melding with people like, Eddie's background and Joe Lang, people like that, so that we get a much more scientific and skilled approach, in my opinion. I mean, like, really excited about a lot of the residents and new diplomates that we have now.
Yeah, I'll respond quickly, just that way. So we keep this. That was a perfect segue, by the way, Laura. So thank you to getting into this evolution, because I did want to have one quick response. But I'll also the interesting aside with me and I am not a veterinarian. I have no medical training at all. So I have a PhD, right? And my focus was within psychology, with minors in neuroscience and animal behavior. And I come from a behavior analytic and a behavior systems and comparative psychologist background. So laboratory research, zoo research, some companion animal research and work. What was exciting for me was, and my current position as a senior lecturer in a vet school at University of Adelaide, was just that we have an animal behavior program in the School of Animal and Veterinary Sciences at University of Adelaide. And although I'm one of the only one of the few non-veterinarians, and one of the only non quote unquote hard science faculty members in the school, I still am that there is that infusion, both of an animal behavior program and doctoral students, as well as the fairly new undergraduate program within the vet school. But then also the fact that, as you were mentioning, we're seeing a lot more infusion now of not just the knowledge, but the research, the behavioral side of things with vet school. And so I think that's an important part of the evolution. And then I'm going to shut up there, because I just made my point, and that's enough.
Well, it's a good point to make, right?
Yeah. Well, thank you. That was
But
I was agreeing my point was good. No,
Eddie,
Yes.
don't say you're not hard science, though. We're not perpetuating that myth that behavior isn't hard science.
Well, and that's why I did the air quotes.
I know.
So because it's an interesting transition that has happened, especially in the past, really in the 21st century, that I think it was a lot. There was that bigger distinction between the social sciences and and what we would call, STEM, or even the life sciences, etc. So we can go into biology, and then chemistry, physics, math, etc. But there was a clear distinction, and psychology has melded a lot more, especially in the past couple decades, with psychobiology, with neuroscience. There's so much infusion there, and my entire doctorate was really, I spent most of my time in doing behavior systems work, which is best described as a bridge between behaviorism and ethological work. So all right, again, I just threw in that little caveat, and then go back to Chris.
Now, I want to pick back up with where Laura was talking too, in terms of the evolution of the discipline. I think it's been amazing to see and to be a part of. I'm grateful that early on in my early training, even when I was finishing up vet school, well before I even considered coming back into it as a specialty, I had a couple of mentors in the dog training community in the Minneapolis-St. Paul area. And I remember getting a bit finger pointed at, like, if you go into veterinary medicine and if you don't take all of these training points into what you're doing as a doctor, we're going to be really, really, really disappointed in you, because all of this stuff matters. And I remember especially Becky Schultz wagging that finger at me back in the day. And it's always stuck with me as sort of, it's so important, you know, and as I think back over the evolution over the last 20 years and sort of what I've even learned is, you know, gosh, our observations in the clinic are so much around the topic of behavior. Even if someone isn't doing behavior in any particular way, the observations and what they share and what we're really utilizing as our clinical parameters are very much tied in there. And even if we jump into, let's say, the role of the vet behaviorist, and even if that was something that was limited to diagnosing and prescribing, which it's not, there's so much more to the story now, but even if it were, understanding what we're seeing and how we interpret that directly informs, at least in my practice, sort of how I prescribe and what I'm looking for, and how that all works together, versus, you know, simply coming at it by saying, oh, here is the pattern, here is the diagnosis, therefore here is the treatment. I mean, it's all this interplay with these complicated layers that are just so incredibly rich to tease out. And that, I think, is really, especially in the last, 6 to 8 years, is something that we're really diving more and more and more into. And it's keeps me going every single day.
Yeah, I love the fact that we are talking about the evolution this way, because I'm that different person from you guys. It sounds like that I came into this with no training background whatsoever. I fell in love with this field because I loved ethology, probably since I was a kid. I was always fascinated by why animals did what they did, or why people did what they did, for that matter. So that was the direction I came at it. And there was no behavior college when I was in vet school. So I had no idea how I could merge these two interests until I got out into practice. And it was seeing animals lose their lives because of behavior problems that really convinced me to go this way. And I even went to into a residency where our training probably was much more the clinical, as Dr. Pachel talks about, diagnosing, treating, medication, but have loved what I have learned and what I have seen us do over the last, 20 years, and how we've, I mean, when I was first really introduced to ABA, or, functional analysis, I was like, oh my God, this is so cool. This is so much clearer than the path I had been on. And so it is a wonderful melding. I mean, I admit I'm still very fascinated by pathologies, by abnormal behavior and the neuroscience. But the fact that these are all these approaches that allow us to help animals.
Yeah, and I think your comment about pathology and behavior is interesting too, Valerie, because, as medical professionals, I think veterinary behaviorists, we're always sometimes frequently wanting to say, oh, these behaviors, again, there's this dichotomy, it's normal or abnormal. Right. And I think that's like the whole nature nurture thing. Like, we can't make that definition or division. Right. And the more we've learned from ABA and, people doing research with autistic children, and we're starting to realize that what appear to be pretty severe pathological behaviors, like self-injurious behavior, is often still a very simple ABC, contingency induced by the environment, and not because the person or the dog or horse or whatever necessarily has some horrible thing wrong with their brain that is immutable. So I think even within, I at least try to, tamp down the maybe approach or the medical desire to, catalog or label like that, and realize that these environmental influences have a pretty strong impact on even things like fear and anxiety and repetitive behaviors.
I think that's what probably keeps me so fascinated in the field is, again, knowing that there's this gray area. You can't really say something, like you said, is normal or abnormal. And I love the comparison to nature versus nurture, because I've joked about that for years. It's not an either or thing. And yeah, I think we just get better and better as we start to recognize that it's not that simple. You can't make those dichotomies.
Yeah, I was gonna throw in, and I was surprised we didn't end up making this one of the talking points, and I kind of wanted to leave it off for some. I figured there would be some discussion at some point, but Laura, you got at this point, and you and I have had conversations. Gosh, we've had conversations in a couple different continents about this, and talking about this abnormal versus normal, or what that means, especially in reference to things like repetitive or stereotypic, or what we could call even compulsive behaviors. I go back and forth on the term abnormal as is, as from a behavioral standpoint. What I end up saying is I'm okay with the term as long as we're clear about what the operational definition of it is. And if the operational definition is simply it's not typical, that's all we mean by abnormal, then I'm okay. But if we're saying, oh, but this is a result of something and it's causing these other things, and it becomes a circular in its logic, so it becomes tautological, that itself is problematic. That's what I tend to stay away from. But it's interesting to see how that relates to stereotypic behavior, and especially with some. In fact, there's a great review that just came out for canine compulsive behaviors by, is it Belinda Walsh? Walsh 2020, reviewing what the literature has to say about this, because there is some divergence between this medical model approach and this what she's calling a cognitive behavioral approach, at least in terms of its diagnosis. But I would say probably more along the lines of an ethological behavior analytic or behavioral approach is how I would think of that. But anyway, I just wanted to go into that segue, because that part, the abnormal, what we're talking about and when we use the term, is really important.
Yeah.
I tend to often describe to my clients that it's easiest if we just look at everything on a bell curve, and here's what most do.
Yeah.
But what does it necessarily mean when you get to the far end of the bell curve? It's not like we can draw a line and say, okay, from here on it's abnormal. You're just at the far side of the bell curve, and leave it at that.
Yeah, I think as long as we just don't assume what the function is when we use the term, I'm okay. So if we're just using abnormal as a topographical category to say it's not typical, it's atypical, I'm okay. My fear is when we start using it as that, hey, here's the cause, and this itself is, and it's both the reason for and explanation, or reason for it, so it's the explanation and result itself. That's where I see some problems. But
yeah, and that's like, I still, when students and stuff ask me things like, well, what are the definitions or the differences between the terms stereotypy, compulsive behavior, repetitive behavior, and I'm like, well, frankly, it depends on whose source you read, and I have always had an issue with defining particularly compulsive behavior or things like stable vices in horses as functionless behaviors. I'm like, they're clearly not lacking a function to the animal if the animal is repeatedly doing them. Like, that violates the whole, principle of consequences. So we don't know what the function is for them, but I think it's erroneous for us to define the term that way. At least that's my opinion anyway. Other people, I'm sure, will argue that.
Well, I think the way the word I learned that always stuck with me about stereotypies was apparently functionless. So
yeah, but they aren't
to
even
us,
apparently functionless.
To be, or we don't
Yeah.
know what it is. So it's kind of the way, but you're right.
Should be a behavior of unknown function,
Yeah.
you know,
That would
not
be better.
functionless.
Yeah.
I will say, and since I've done quite a lot of research in this area, and I've spent a lot of time presenting on this, and it's not as divisive, this idea, as you might think. The idea of what are stereotypies. It's not as divided. It's not. So what I would say is there is how most of the research community, almost all of the research community, treats it, which the standard definition is still very much going back to the Georgia Mason, Oddberg definition of stereotypies being repetitive, invariant behavior patterns with no obvious goal or function. I can repeat that definition verbatim. That is repetitive, invariant behavior patterns with no obvious goal or function. What Georgia Mason says, even in Mason and Russian's textbook on stereotypic behavior, she says this in the introduction, the start of the chapter. She says, because we said there is no obvious goal or function to the behavior does not mean that we meant there is no goal or function. That was always, it was her saying, we don't know what the function is, but the behavior is clearly not functionless. So there is, and unfortunately, there have been a few people in the literature who are not studying stereotypies. So there have been a couple people. I actually took a zoo researcher, a zoo scientist to task because they repeated this idea of stereotypies being functionless. And I said, no one is defining it that way, including Georgia Mason. They are not saying this is functionless behavior. This has been more of a problem for a diagnosis from a non it's not supported by the empirical literature to say that that stereotypies are necessarily functionless. So again, I could go on and on about this. I'll shut up again. I'm causing myself to shut up and just simply say it's not as divided. So there is that clear understanding of what are we looking at here.
I think the piece that comes to mind for me is less about whether it's divided and more just thinking about the different disciplines and how we approach sort of the same animal, right? Mm-hmm. So if I'm looking at it from let's say any pattern from a medical model standpoint, you know, and I'm sort of broadening it, not even just looking at behavioral patterns, but looking at anything that the animal is doing. The medical model, at least the way that I was taught it, is sort of looking at sort of what are the observables or the measurables and sort of what clusters together. So if we see certain things, like we may have a dog that, you know, looking at, let's say, a Cushing's diagnosis, sort of a pattern where we may have a dog who is of a certain age or of a certain breed or size, who shows an increase in appetite and an increase in, you know, urination, for example. So we look at these individual discrete observations or measurable criteria, and we look at differentials. Well, you know, that increase in appetite could be any number of these 15 different things. But then we start to see the same things emerging and they cluster together to say, well, actually, of all of these things, something like Cushing's or some other endocrine disorder is likely to be at the top of the list. And so what I love about that approach, not that it's better or worse, it's just the way that works, is that it allows us to put labels on things with all of the caveats that go along with labels, is that it allows us to start talking about a cluster of individuals who all have been diagnosed or labeled with the same pattern, and then get into that bell curve that Dr. Tynes was talking about as well, in terms of saying, well, how does that represent, you know, itself across the entire pattern, knowing that the individual animal may need to be treated differently than the next. But generally speaking, we're talking about a similar cluster. And so I love the medical model for those reasons. and yet also love being able to say, okay, yeah, I'm going to do all of that and put that aside over here because I'm going to take an ABA approach with this animal because I actually don't know enough of the data points. So let's just talk about the observable behavior, focus there, look at our antecedent conditions and how the behavior changes when we really manipulate that contingency, and look at consequences and what happens when we manipulate that. And it's again, not better or worse, but I love when we're able to look at these patterns from multiple angles and see which inform one another to create a more three-dimensional understanding of whatever it is that we're looking at, whether it's compulsive disorder or whether it's something else entirely. It's so important that we as vet behaviorists have that knowledge, and we're talking with individuals from other disciplines, whether those be dog trainers or behavior consultants or PhD research fellows or whoever that happens to be, to say, hey, what do you know that I don't? And what can I share that I've learned from my studies? And what does that do when we put the two together, or the seven together for that matter?
Yeah.
Yeah.
Great points.
I'll throw on there because this is an interesting point. We're getting into some of our second point about talking about a function in relation to this. I think often it's been pitted as a bit of a divide between this behavioral functional approach and the medical model approach to understanding behavior. And there are a couple important things I say about that, which is, one is, it's not black and white. So let's be clear about that. That there's a reason why. I talk a little bit about the history, and the history is, of course, the medical model has been used the way it has been used because looking at symptoms was a great way of understanding the cause of some disease when we're looking at physiological disease. It's incredibly, I mean, that we have thousands of years of good medical history of doing that. And then it ran into a little bit of a problem with trying to use that same model, applying it to behavior. But, and here's the big caveat, the most important point. We know that it's not as if we can only understand function through experimental manipulation. We know that we can get at function, behavioral function, even through observation, and that includes categories, topographical categories, which means medical model symptomology, right? So there's somewhere that we haven't gotten to yet. We're getting there, and this ties into the first point of the evolution. We're getting there, right? Of how this all works together. That I I'm hopeful for. I get excited. Maybe not as excited as you, Chris, but I get excited about this future where we start seeing how this all blends together in a much more pun intended, in a much more functional way.
Yeah, it's so true. I mean, like, I can look at it as a veterinarian and say, cool, this is what this adds to the conversation. For me, the tricky spot is if I get stuck there. And if I'm only looking at something from the medical model as an example, and I'm not willing or able to see it through other lenses, well, now that medical model becomes very limiting, which doesn't mean that it was inherently positive or negative. It just can't be the only way that we're looking at these issues. And yeah, looking through that lens absolutely informs us in certain ways, or allows us to perhaps go, wait a minute, this particular pattern, like say we're talking about something like separation anxiety and noise phobias, for example, they can go together with a certain degree of frequency. So like if I make one diagnosis or put a label here, I know that there's at least a probability that something else may also occur. So it allows me to say, hey, the owner hasn't mentioned this, I haven't observed this, but this would be a really important data point to suss out, to see whether this is also a concern. Whereas if I was only looking at, let's say, the behavior of concern, I might miss that entirely. And that may have a significant impact on the outcome of treatment for that particular individual animal. So it's again, it's not better or worse. It's just, God, there's so many layers to it.
Yeah.
I've always looked at, when we refer to the medical model, to me, I've always said that's really just something that should allow us to communicate with each other. right? So that when I say separation anxiety, you have a general idea of what I'm talking about, right? Or noise phobias. But I remember saying to my resident once, it's okay that we think about giving these things names. And we have to, unfortunately, as a part of our training and writing cases and that sort of thing. But we should never assume that those terms tell us anything about what is going on at a neurophysiological level. And that's where I think, the medical model, if we're not careful, could lead us astray, especially if we start trying to use terms, in my opinion, using things like compulsive behavior in an animal. I think it suggests that we know something we don't. And that's always.
And I think that's important, Valerie, too, because like you said, when we use terms like separation anxiety, or, it doesn't tell us how that individual manifests. And then, in order, if we're going to communicate or even make notes to ourselves, like, then I end up dividing it out into like 4 or 5 different types of separation anxiety because they have different presentations. And then it also has an impact on how some of the research is done, because when you look back at some of the data that was done for, in particular, some of these drug studies, you're like, well, what type of functional process was used to determine if a dog was, say, destructive when the owner was home? When the owner was gone, did that dog really have separation anxiety the way we think about it? A true anxiety, or was the dog tearing stuff up because it was left out of the crate and it was 9 months old? I always wonder in some of these studies, when we say, it took, 50 dogs that have separation anxiety, and in, 4 weeks, 50% of them were better. Well, how were they defined and operationalized to be included?
Yeah, and even Laura, if we look at, I know that we could dive into each of our individual sort of case populations and pull out examples, but I remember, one of my patients years ago that, yes, presented for separation anxiety, and yes, the body language was consistent with distress, and we confirmed all of those details, and yet the causative sort of etiology of that particular animal's behavior was because there was a storm that occurred when the dog was left alone and a tree fell on the house. So very, at like age 4, like that's a completely different learning history that animal happened to associate with the experience of being left alone, that had perhaps nothing to do or very little to do with emotional dependence or hyper attachment to a caregiver. And so how am I going to say that those are likely to respond to the same therapies? Like they might, if we're sort of in the same ballpark, but it's that the backstory, when we know it, can absolutely inform it. Or if we don't know it, how do we tease that out based on the other observations that exist?
Yeah, and I would suspect, or I would suggest that we know the fact that we know so little about that backstory of so many of our patients nowadays, at least again in my population, it seems like I'm always seeing rescue dogs that are already adults and they're presented with whatever problem. When we don't know anything about that, I think that has handicapped us historically, right? Because we've tried to put these labels on things without realizing that there were these all these potential underlying differences. Stereotypy, research into compulsive disorder, stereotypies, whatever you want to call them, is one of my pet peeves that I think we have a lot of old research out there that we still talk about and refer to. And I think the quality of it is not as good as it should have been because of the way they lumped patients in some of those studies. You look at some of those old studies and they included tail chasing dogs and, blanket sucking cats. And I'm like, how or who ever assumed that, again, the underlying cause, whatever, or function of every one of those behaviors is the same just because we call them all repetitive behaviors or stereotypies.
I think also, and I agree with you, but I also, it's it's easy for us to look, knowing what we know now and the data and the science we have now, it's easy for us to look back and go, wow, that wasn't the greatest, but they were looking at those patients from a different lens than we get to now. So I think it's just the importance of ongoing research where we revisit some of these studies and reevaluate data with our new knowledge base so that we get the most accurate information from it that we can. And of course, we keep moving the field forward instead of, like you said, just repeating the same old data that, may have been misinterpreted because of limitations at the time.
Yeah, I will say that one of the interesting things, again, similar to when we're using something like a category like abnormality, that stereotypies, what I've often argued, and many, this is what a lot of the stereotypic research, especially more recent research, is showing, is that it's just a broad topographical category, and there are a lot of different potential functions involved. So this is for any including any type of repetitive or compulsive behavior, whatever we're going to call it. We're going to call it a stereotypy or whatever. But there are often large functions involved when we talk about appetitive or escape related functions. And just because the behavior itself is repetitive doesn't mean that tells us all that much. But, and this is going back to Chris's point, part of Chris's point is we can actually start to, and getting at the opposite end of this, from a behavior analytic point, this idea that we can't know the function of behavior in the absence of traditional functional analysis. Well, first off, what identifies a traditional functional analysis is changing. If you look at some of the work that Greg Handley and his colleagues have done, they're talking about this. It's almost more just simply as an experimental setup for within subject methodology rather than this traditional Awadian approach. But the other thing is, although I'm a big advocate of understanding function through data, and I'm very skeptical of some of the attempts that are made with functional assessment in the absence of really manipulating those variables. And I think there's some simple ways to get to that, but I'll shut up about that. There is the point to be made that we can understand a lot about the function of behavior, or at least some things about the function of behavior based on its topography. So to simplify that, how it looks can tell us a lot about why it occurs. So that was my non-academic version of what I just said, right? How it looks can tell us a lot. And we can learn important things about repetitive behavior based on how it looks. And there's another, I'll throw out this last reference that's worthwhile mentioning here. Dinwoodie et al. So Dinwoodie with Dodman as one of the authors, as the advising author on it. Dinwoodie 2019 looked at comorbidities in dogs with separation anxiety. And Chris, you'll find this right up with what you were mentioning. One of the strong positively correlated comorbidities was not just noise phobia, but specifically thunderstorms with separation anxiety. So again, the topography can tell us a lot about, can start to help us identify some factors relevant to function. I think we need the experimental analysis and the quantitative data to push forward from there, but that's something we can come back to after I've shut up again.
Yeah, keep it coming, Eddie. I love the details, and something that I'm always a little bit jealous of is I tend to focus on the sort of the individual animal in front of me, and even when I've read research and I've studied it, the ability to sort of go like, oh yeah, this paper in 19 and this paper in 14. Oh man, it's a skill that I wish that I had. So I'm like, when you start making those references, I'm like, yeah, bring it, give me more. Because I've always I'm an admirer of individuals who have a brain and a mind that works in that particular way. But no, I think the other thing that was coming to mind there too is, you know, when we get to the point of having a label diagnosis or whatever we call it, there's also, I think, a limitation if we then assume that we know what the treatment is going to look like, you know, and again, thinking in the medical model using the word treatment versus, you know, someone says, well, what's your favorite medication for separation anxiety, for example, or, you know, what med do you reach for the aggressive dog? I'm like, oh, like, no, it doesn't work that way. I mean, I guess it could if you weren't paying attention to any of the other variables, but it shouldn't. It really shouldn't, because, you know, it's understanding, you know, what are we actually treating here? What's the goal? Are we talking situational support versus maintenance? And do we think, based on, as you're saying, Eddie, the topography, that perhaps serotonin is more relevant versus GABA versus, you know, norepinephrine versus dopamine versus something else? There is no one size fits all. And so there might be a starting point to then say, well, we've got this diagnosis, we've confirmed separation anxiety, for example, and we have research to suggest that fluoxetine or Reconcile is an option for that. Cool, let's start there. And then let's look at how the animal responds, not just saying, did it fix it, but what was the response, and did that improve the animal's receptivity to behavior modification? And that important part of actually changing the way that they think or feel or do in that moment. And then we can come back and say, oh yeah, no, actually a serotonergic based approach actually probably was helpful for that dog. Cool, good to know. But we can't make assumptions about any of that until we're actually looking at the individual animal, in my opinion.
Yeah, that's a great point, because, you know, you never want to seem unhelpful when, you know, owners or veterinarians or whatever ask that question, but it's just not like, there's just no answer for that. There's not a category drug, you know, like you said, it's an N of one. And even if you took, you know, 30 separation anxiety cases, they're all a little bit different and their environment's a little different. And so the drug tailoring is going to be different.
Yeah, I sometimes will use the example when I'm talking with veterinarians doing vet-to-vet consults. You know, if they ask a question like that, I can sort of honor the question and appreciate the idea that we would want something that simple. But if I turned it around and said, cool, I need to anesthetize an animal, what's the drug for that? Or, cool, I've just diagnosed an infection, which antibiotic is the one that works? It's like, whoa, wait a minute, what's the infection? What's the organism? What's the tissue type? Like, all of those things matter. And I'm grateful when I'm talking with veterinarians, those examples are often much more familiar to them. And we can tap back into their understanding of that, the medical model in those contexts, to say, cool, behavior's the same. It's exactly the same. It's not this weird, different thing. It's exactly the same thing you do over here, or at least it can be in that way. So let's use what you already know and put it to good work and actually help more animals in the clinic than what the veterinary behaviorists alone are able to do.
Yeah, one of the things I like to, it at least helps me humble myself, and I'm always looking for excuses to humble myself. Anything to deflate my own ego is I think a damn good, worthy task. But I like to say, at the end of the day, we're all kind of just bumbling around in the dark. We're all lost in space with this stuff. I mean, every scientist feels this. I feel like every scientist at least should, I think, feel this at some level. We're lost in the middle of space. Maybe not like Bezos' space penis lost in space, but somewhere along those lines. So we're lost. We're in the dark. We're lost in space. We're just looking for simple answers at some level in how we can get at some minimal amount of understanding of something that works. But that's often all it is we just happen to land on something that worked a little bit for a little bit of time, and to then try to take that and say, and now I know everything about what's here in the dark because I figured out where one light switch was, or I figured out how to, you know, hit that one thing that turned the light on for 5 minutes. That's where I want, you know, I expect us to at least be more humble about these kind of approaches that we take, that we go, I half the time, not half the time, 99% of the time, I'm just sitting there going, I think I kind of know a little bit, and that's what I got.
I think when it comes to medication, I always think that way, and that kind of hopefully helps me stay on track. It's just, and I'll even tell clients that we really don't know that much about what these drugs are doing. So you have to be prepared for us to, kind of muddle around in the dark a little bit, trying to find the answers. But yeah, I think there's so much exciting stuff there that we're going to be able to learn, hopefully, in the future that will help animals. But yeah, that's the thing right now. You are looking for, like you said, something simple, because that's what a pet owner needs. They want the simple answers, the simple approach, the simple things they can do. And I think that's a challenge all in itself, is making something that's not really that simple enough for them that we can have a good outcome.
Right.
Yeah.
I think I struggle with that every day.
Yeah.
I love that piece. That's actually one of my favorite parts about practice, getting into the communication side of things and working with my residents and trying to navigate that. I think once we move very quickly beyond what the literature actually tells us, for all of the points that we've made, like, okay, cool, we know this little bit, and then what? Like, how do we actually connect with our clients or with our veterinary colleagues or other disciplines to then say, what are we going to do about it, and how do we put those options out there? Even coming back to the medication point, for example, there's a lot we don't know. I think based on X, Y, and Z that this is a logical choice, and we'll know in 4 hours or 4 weeks whether or not we're on the right track with that. And setting those expectations so that we're able to look back and say, cool, now that we've learned a little bit more about what your animal's physiology looks like based on their response to certain interventions, now what? Does that still feel like it was the right approach or the best approach, or do we really want to change gears and try something completely different? And I think specifically thinking about medications, having that conversation on the front side so that clients aren't feeling like we're necessarily just sort of throwing spaghetti at the wall in hopes that some of it sticks somewhere, but it's the response to those trials that really does start to create more of a three-dimensional understanding of what's going on the inside. And that's, in my opinion, that's when it really gets fun, is saying, oh, well, if that worked, then if we do this and we manipulate that piece, and oh, if that worked, then that tells me something about the underlying this. And so now the training standpoint can modify. Just gets so much fun.
Yeah. I was gonna, I'm gonna reward Chris's compliments on my referencing here, but throwing out, I was gonna say another interesting, talking about proximate functions and looking at incorporating things like functional analyses into understanding repetitive behavior. Just to go back to repetitive behavior for a second, Nathan Hall, along with Sasha, and I will not try to, I never successfully pronounce her last name, but Sasha, Prop, blah 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 blah. So the Sasha's she's gonna at some point I'll talk to her and be like, Sasha, can you just somehow, I don't know, here's a bag of candy, and let's say your last name over and over again, and every time I get it right, just give me
You're like Marion de Marchelier.
I'm terrible with names. So the point, I'm going to go off on that tangent for a second, but Nathan, Sasha, and Clive Wynn put out a paper in like 2014, 2015. And all these things, I'll throw up references when we get this chat up there, but looked at some compulsive behaviors and stereotypies in dogs, including light chasing, and did functional analyses and looked at potential functions of the behaviors. So that's a paper I like to mention to people too, about understanding some of the importance of proximate functions for some of these repetitive behaviors, and where things like rewards can play an important role.
Yeah. Something else that factors in there, whether we're talking about repetitive behaviors or other things too, I think I think Danielle put this in the chat as well, that the medical history is such an important part of what we do as veterinary behaviorists. And it's true, right? Even if we start looking at certain types or certain topographies of repetitive behaviors and say, well, this is an animal who's doing this, tail chasing, for example, to pick sort of an obvious one, have we actually ruled out the medical causes before we even think about the functional behavior? Although, I mean, functionally could be soothe the itch or stimulate the painful area or something else. So yes, it falls in there, but really understanding that interplay between physical health and the expressed behavior changes that we see is so rich. And I'm amazed, truly, when I talk with veterinary practitioners, when we start to kind of peel back the layers a little bit and say, oh, well, pain can look like this, but it can also look like this and this and this and this and this. And really starting to see what that looks like when we can inform one another, even within the veterinary profession, by teasing out those medical histories. Just there's so many things that we have to consider within that.
Yeah.
Yeah, I think we keep learning more and more about the interesting behaviors that can result when an animal is experiencing pain or some altered sensation.
Yeah.
I think that's a fascinating place to go because, well, and in part because I worry about all these animals that maybe we've been, again, trying to use a behavior modification at the same time that they are still suffering some sort of pain or discomfort. And
yes,
I hate the possibility that we may be missing those again just because the behaviors of pain look different for different individuals.
Yeah.
Well, and it's not even just looking at the behaviors that might be caused by the pain, like Chris talking about tail chasing, but it's so important to recognize that the animal's pain status or medical status and how that's going to impact your treatment and your behavior modification interventions. Because, if you have a dog that has unresolved cruciate ligament tears and, bad DJD, then you're going to modify the exercises that you're going to do, because you can't have that owner go home and practice having the dog sit 50 times a day, or, walk back and forth up and down the street, practicing U-turns, spinning on their, arthritic hips. Like, we need to know those things so that we're not, do no harm, and we're not taking cookie cutter recipe exercises and sticking them on an animal that we're going to actually worsen their welfare trying to treat the problem.
Yeah. I also worry about some of the things that really aren't terribly visible. And I think I'm a little bit biased here in that we've had a couple of cases that have come through the practice with a couple of my other doctors in the last couple of weeks, even, where the history was suggestive of the onset of behavior change at a time that couldn't quite figure out. I think, and these are all sort of looking back with the ability of looking at that full history at the time of assessment and diagnosis, but seeing these cases where there was a previous onset of behavior change that wasn't completely clear at the time following that animal forward. At some point, animal has a seizure event, animal is placed on anticonvulsant therapy, appropriately so, and then sees a substantial improvement in that previous behavior change. So the question there too is, again, how many times where we see some of these changes where even if we can identify a particular function based on antecedents or based on consequences, that doesn't automatically mean that there is not something physical or physiologic that's going on underneath that if we had the ability to truly see all of those layers, and we don't, even if that dog had gone through all of the diagnostics, one of the dogs that comes to mind had an MRI, they had seen the neurologist, nothing showed up, and yet with the treatment trial, there was clinical improvement. So I think, coming back to your point too, Eddie, about, looking for those humbling moments, the moment we say, cool, I did the test and I ruled out, ruled out to the best of our ability and knowledge, those particular patterns until such diagnosis. There's so many caveats, and we have to, right? And it's not just to cover our own butts, but truly to say, as we change the information and the understanding, the whole picture shifts, literally right in front of your eyes. It's incredible to see.
Yeah, I was gonna say there's some, and especially the conversation about pain and how that relates, and just medical, the understanding what's happening at a medical level and how that can affect behavior. So what's going on physiologically, all of these things are really relevant. And it's something that I think behavior analysis tries to attend to here and there, but it's not always done all that great of a job. In the least, I say, you know what, just treat this as a condition that you may not be able to directly manipulate, but you can at least examine things around how that, what's going on there. But I will say there's a couple interesting points about this that I'm writing this historical paper right now, and I'm going through all, I kid you not, all of Hal Markowitz's old stuff. If that name's not familiar, everything that he had written. Hal Markowitz was somebody who in the predominantly in the 70s and 80s started the field of environmental enrichment within zoos. So with Portland Zoo and San Francisco Zoo primarily. And one of the things that he talks about, now he talked about this as behavioral engineering to start with, but one of the reasons and the importance of enrichment that he talked about was the amount of times that they were able, through the process of providing enrichment to an animal, to diagnose a physiological problem in a serval that had a diaphragmatic hernia. Did I say that? Is that the right description? Yes.
Yeah.
Perfect. All right, diaphragmatic hernia, and for a serval that wasn't able to leap up for enrichment. I can't tell you the specifics about what was happening with the eyesight of the elephants, but a couple Asian elephants that because of this this enrichment procedure they use, they found that these elephants weren't able to make a discrimination. So they were diagnosing these medical ailments in these animals through trying to change their behavior. And
Yes.
it's such a cool thing to see how that can work. And that's important. Actually, I think there's a paper, and I'll throw the reference up there because I can't even remember the author, but there's a paper that talks about specifically some of what's known academically from hiding injury. I think it's actually Stephanie Edlin who's here. I think it's a paper she got me that, and she'll probably be able to type out the reference or say something about it or let me know later. But talking about the fact that we know animals will hide their injuries, right? So they'll hide potential ailments that they're suffering from for important reasons, to not get predated upon in the wild. Those are some of the things that through this interaction of providing behavioral opportunities through enrichment, through training, that's how we may end up diagnosing them. So again, that bumbling in the dark that we come upon something like what you mentioned, Chris. So
Yeah, I
yeah.
want to comment on, I hope I'm pronouncing the name right. Is it Zuzia? The comment she made, I hope it's not a name I'm familiar with. I apologize if I just butchered everything. Because this is, I'm sure, an issue that Chris and Valerie and I run into a lot, which is trainers. You go to and do seminars and they come to us and go, oh, how do we get these vets, to do exams on these animals? And really, this is a collaboration issue, because part of the problem is this is a weakness in our profession right now. It's and this kind of ties in a little bit, Eddie, to what you were talking about, using enrichment to give us more pieces of information, is that unfortunately a lot of our graduating veterinary students right now don't know how to connect these dots. Like, they don't recognize that you can use these different pieces of information to indicate behavioral information, to indicate that there's pain or spasm or paresthesias or other types of physiologic alterations that are contributing to a behavior problem and altering. I know when I graduated vet school and I first started doing behavior, I frequently, and still do, diagnose dogs, especially small dogs that have dislocating kneecaps and they have arthritis in their knees because of it. And I often had even orthopedic surgeons tell me, well, that pain can't be bad enough to be causing the biting behavior that you're dealing with. And I was always like, well, I don't know how you can say that because it's not your pain, you know? So fortunately, we're becoming much more open. You know, I do some horse work too, so I'm very excited to see how much the equine world is embracing looking at pain sources for horses that have behavior issues that in the past were always chalked up to personality problems, you know, and whatnot. So it's just a matter of us educating ourselves more, like I said, collaborating, teaching each other so that your piece of information, you know, your specialty, you share with us and we share with you so that we try to fill in some of these gaps and all do a better job.
Yeah, it's definitely true. And there was something, I think I saw a comment scroll through in the chat as well, in which you know, I want to put a sort of little bit of a shout out to a lot of the practicing veterinarians who are out there who sort of are curious and who are open to doing some of these exams, but as you said, Laura, did not have the education for one reason or another to understand that. And so the animal comes to them and they do probably many cases a very good physical exam, and there's nothing evident on that exam. And unless you know how various medical issues may manifest as behavior, you wouldn't know to necessarily say, oh, we need to run some additional hormonal or endocrine panels here, or, well, you know, the knees feel a little unstable, let's do a pain trial to see whether or not that informs things. You know, it's that sort of next layer of curiosity. And so I try to, as best we can, you know, help them understand both in the trainer or the behavior consultant side, as well as on the veterinary side, say, hey, let's be curious. I don't know if this is painful enough to cause or contribute to that form of aggression, or maybe it was when it started. Now the animal has developed some other compensatory mechanisms to reduce the pain, but the learning pattern is still there. Like, it's teasing that out, and when we manipulate one or two factors, then how does that response then change or inform as to what's going on now? It's complicated. And so yeah, again, coming back to the comment to veterinarians, I sometimes hear the frustration from individuals. Yeah, I send the client back to the vet and nothing happens. Yeah, I know it's tough. Right, it is tough, and you know, there are ways that we can inform that collaboration just perhaps a little bit better than we already have, and it's a work in progress is the best I can do.
I agree. I've been in that situation many times myself, where I've been trying to convince a veterinarian that, you know, there's something going on here from a physiological perspective. There's something affecting this animal's behavior. You may not know what it is, but let's try to look at that first before we start just sticking them on behavioral drugs, which is what so many, unfortunately, still.
And Valerie, bringing your perspective in, because, you know, you obviously work for an animal health company, you know, some of our limitations to knowledge, and it's not any kind of a judgment of animal health companies, but, you know, funding and motivation for studies. And the more we can encourage and support companies and organizations like Morris Animal Foundation and places like that to look into some of these behavioral studies, or these studies where we're looking at the integration of a behavior issue with medical status. Again, you know, the more data points and the more information we have, we're all just going to be able to do a better job in the future.
I agree, and that's a great point.
Yeah, there's so much to do there, and I think it's, you know, coming back to some of the conversations that we were having earlier about how many layers there are to some of these, you know, and how it can be so difficult to lump some of these categories together. I mean, I've well, even as we're talking about pain and then saying, well, if the animal is it painful today and that's why it's reacting? Was it painful 2 weeks ago and there's a learned influence? Is it painful and that's not so bad, except that it's interrupting sleep patterns? And so now we have actually what we're observing is sort of sleep deprivation. And so when we treat the animal with pain control, unless we're doing it long enough for that sleep deprivation to, I mean, there's just so many ways in which this can all connect, which is, I think, is one of the reasons to remain curious as we go through this. And yes, the data will help. And I fully expect it'll raise even more questions. Thinking about, back to when each of us were going through veterinary school and working through our residencies, we're like, oh, cool. This is amazing. We know so much more today than we did 10 years ago. Look at how good we are. And then you look back and you're like, wow, that was like stone age of the discipline. And look at where we are now, and where are we going to be 10 years from now, or 10, 20, 30.
And all those, all those layers are what make this fascinating to, all of the people like you and I. But at the same time, when you think about how many layers there could be, or there likely are, it also becomes quite overwhelming. And then when you bring in all these classically conditioned, first and second order conditioning, on top of the, the medical models, like how many of our animals are developing alterations in their behavior, their physiology from first and second order classical conditioning on top of like the baseline problem. Like, and then my head just wants to, I love it, but then you're like, oh, talking about spaghetti on the wall.
Yeah, for sure.
I was going to point out, so Nate made a comment here, and he was talking about, just because there was something related to this that I wanted to mention too, which was just how we're ultimately assessing pain at any level. So we can talk about that behaviorally, physiologically. That's one of the things that I hope we do get better at. And it's one of the things I'm excited about too, in general. So this is a broader note, but with being attached to a veterinary school, for my faculty position, is the amount of physiologists and veterinarians that I'm going to be able to collaborate with on projects where we are trying to assess at some level this interplay between behavior and physiology. But there was an important point that Nate mentioned here in talking about CBD, which is always I have a simple response that I give when we talk about the use of any kind of medication or anything at any level. So something that we're assuming some physiological effect. So let's just call it medication broadly. And that's that I say. I understand you're going to try to use what your interest is in what works now, and you're going to use your own anecdote as an assessment for that. But what we should be at least cautious about is what we assume based on that anecdote. So we don't know, and be aware of when that does have potential harm. So don't buy, because you have to do what you're going to do what you think is effective at that moment. I understand that. Just be careful with what you assume about what your anecdote is telling you about whether it is or isn't effective. That's my simple point.
Yeah, and I think this is, they're always going to be, I'm just, I guess, going to kind of pick on CBD just because it's the big thing right now. Like, I mean, it really is kind of a fad. And, someday we're going to have research, and I truly believe that someday we're going to have good data about type of product, dosage, and what behavior or physical related, like pain disorders, it actually helps. I think that's going to happen. I think we're going to find that it's helpful in some situations. And people are going to try stuff like that because it's out in, Google and the internet, and, friends talking to friends. But as professionals, if we're going to put that into a program or use that on anything but our own personal animals, clients need to be informed about what data isn't there. Like, a lot of people don't realize there is a drug interaction between CBD and, for example, fluoxetine. There are also not too many studies, but probably at least 50% of the studies so far that have been done in dogs and cats with CBD have resulted in elevated liver enzymes in pretty much all of the participants in those studies. So like you said, we can't assume because on the outside that it looks like it works or helps. One, there's sometimes a huge placebo effect, but people just need to understand when people ask me about it, I'm like, I can't tell you to try it legally. I can't because I'm a veterinarian. But if they do, they just really need to understand it truly is kind of an experiment. Like, you know, we don't know what the outcome's going to be. It might end up being great and it might not.
And I typically do try to focus on that issue of data as well. That's what I always, when people ask me about different things like CBD or other, you know, nutraceuticals and things, I always say, if it's up to me and I know what I'm treating, and let's say we're treating pain, or we need muscle relaxation, like I would want to treat with the medication or whatever that we had data to support. Now, if those things don't help, if you try everything that we have in our toolbox that is approved and we do have knowledge about, and none of those things work, well, okay, I'd probably be the first to go reach for some alternative as well. But it wouldn't be the first place I would go when I have so many good tools that have been proven to be effective, especially if I want to treat pain or discomfort of some kind. And I just have to make a quick comment again, not to pick on anybody either, but the concept that the medications we use for behavior in particular, you know, somehow sedate animals or make them, you know, changes
Zombies,
turns them into a zombie. That is something that I think we constantly need to struggle against as people who are educated in these fields. You know, to me, if a medication makes an animal sedated, that's a side effect, and that is or a problem that I want to fix. And I try to help my clients understand all the time that, or I'll just tell them, if you don't like the way your animal behaves on this medication, tell me. You know, if it, you know, you live with it, and if you feel like it is changing its personality in a way that bothers you, tell me. We will change the medication, because that's not what we're looking for. That's not acceptable, and it doesn't have to be the case when we're using medications.
I do agree with you, Valerie.
And sedate.
Yeah, I agree with you, and that's sort of in our hands when we have the ability to really educate the clients and work one-on-one. It's been really eye-opening for me with my affiliation with Instinct Dog Behavior and Training as well. With our, you know, we've got multiple locations open throughout the U.S. now, and getting into conversations with trainers, and, you know, I forget exactly how many trainers we have amongst the locations even right now, but, you know, hearing their responses, they are much more likely to see the lesser educated veterinarians' prescribing habits and the lack of information that's relayed to clients, and the unawareness, the lack of awareness of those side effects. And so the number of times where it gets brought to my attention, even just as a question of, hey, you know, this is what we are seeing within training sessions, is this appropriate? We're flying blind over here. It's really impressive, actually eye-opening to me, just how often that does happen. I totally agree with you that if we were to see that, we would say, whoa, you know, that's collateral damage that I am not willing to accept here. And I think it's really a struggle. And knowing that in many communities, the relationships between individuals of various professions don't necessarily have that open line of communication to allow individuals, whether it be the client or the trainer or the consultant, to in that moment have a way to influence that conversation. It's tough. It's probably one of the questions that I get most often when I'm speaking at trainer conferences as well, to really say, hey, how do we navigate this? And of course, that's a, you know, another 3-hour conversation about what that looks like, but it's tough. It's really tough.
I'll make a final comment in talking about just any type of medication or any type of treatment. Let's just call it a treatment. Any type of, because there's things that we can talk about outside of that, but it's a good segue to talk about this merging of where behavior analysis and vet behaviorism, where are they going? So our third talking point, I think it's really great, but I'll just briefly mention, try to briefly mention, me being brief is not always the best, but there is a lot of stuff. Science can be very difficult in terms of things taking a while to get going. And there's a lot of different things. To put it simply, there's a lot of snake oil out there. And if what scientists ended up doing was investigating, spending all their time just completely changing everything they do to investigate each new snake oil, whether that be magnets, because now magnets are making a big, and I'll just say this simply, there's never been any research to demonstrate any, that I know of, any effective form of behavioral treatment through the use of magnets. Yet you see them coming about again, where people here's your halo for your dog, which has magnets in it, and it's gonna make them more calm, or it's gonna change. There has never been any evidence, human or non-human, that magnets have any effect on behavior as a potential treatment. So, and that's just one of the many snake oils. So there's always different. And my response is to remain skeptical, not to deny the possible cause. As Laura mentioned, there's probably some important and potential treatment effects from potential is the key word there of or similar things, but we just don't know. And these take time. It took us almost a year. Almost every scientist that was able to get involved in developing vaccines for companies with large amounts of funding, and it still took almost a year for that to happen. So imagine when we're talking about, hey, but this is something that might work for a handful of chihuahuas. That it's a little bit more, might be more time consuming. So that's what happens along these lines. Now, where I wanted to segue from that, what was interesting, and this is where I think is relevant, is how are we bridging this gap, this third talking point about bridging this gap between behavior analysis and vet behaviorism. And to me, I think one of the key components, what we've been getting at in a lot of this, and surprise, I'm going to talk about data because I always talk about data, but that's behavior analysis is defined by its ability to understand at a clinical level, to use an N of 1 to understand the function of anything on that organism and its behavior. So that's how behavior analysis has been defined by data. Every part of behavior analysis applied, even at the conceptual level, has used data. And that's where I think the future is for helping. So we have lots of great physiological data that gets taken, and very little quantitative behavioral data that happens at a practical level. So that's where I'd like to see some of the future of behavior analysis and vet behaviorism go, as we start training vet behaviorists how to incorporate behavioral data into diagnosing, assessing, and treating problem behavior. So that was my big spiel on that. And yeah.
I think there's a lot of ways that we can go, right? I mean, I think there's in sort of looking forward, looking back, but sort of the way I tend to look at this. I'm grateful that I get the opportunity to teach at a couple different vet schools in the U.S. So I teach at Colorado State, I teach at Virginia Tech, and then I teach at the University of Minnesota as well. And so when I crunch the numbers, I'm grateful to say that I get about 10% of the graduating veterinary students in the US right now for about 20 hours or so, which is just a drop in the bucket when you think about all of the education and the fact that there's not behaviorists in clinical practice at so many of these universities. So they get it academically, but not necessarily hands-on or practically in quite the same way. And so I know that it's a step in a direction that I'm hopefully being able to bring some of that data analysis and also the sort of the curiosity side and actually modeling what this can look like to show up, stating what we think we know and an openness to evolving the conversation as things go forward. So I look forward to continuing to do that. And I think I'm optimistic that, I know that there are other colleagues in the college who have similar access to veterinary students as well, that we will ideally get a larger and larger percentage of those students with exposure to behavior at the clinical level, and sort of drive forward in that way, as one of the pieces that I think it's coming, I hope, knock wood.
I'm with you, Chris. I mean, I have to be, to me, it's like be optimistic or die because I have to believe that it's going to get better. And I would maybe like to think that the reason we have so many residents right now, and look at our resident group, is it's just surprising to me every time I look at that list. And most of them are young people. They're not all people that have been out in practice for a long time, like some of us were when we went into behavior. They're young people coming out of vet school and saying, I want to learn more about this. And I think that is exciting too. But you're right, we need the general practitioner out there in the field on the front line with this knowledge. And, I just think that, again, 15, 20 years ago, most of these veterinary students weren't even getting as much as they're getting now.
Yeah.
So it is better. It's just, it's a slow process. Yeah. Unfortunately. Yeah.
And I think in addition to the exposure piece, back to your question too, Eddie, about kind of where are we going with that? I think one of the biggest things that I'm excited about is the awareness of these other disciplines. Even thinking about the last, we're in July now, so the last 16 months or so, and just the overall accessibility of information through webinars and in digital platforms, where it's like, oh, wait a minute, you're a neuroscientist talking about behavior? Cool, I'll log in for that. That sounds amazing. Let's look. I would never have gone to your conference. Like, it wouldn't have even been on my radar to know about it, let alone have that. And we've also got some of the other educational opportunities like the Lemonade Conference, for example, that was bringing in individuals from a bunch of different disciplines from around the world to really get that collective knowledge base going and to make it more accessible and affordable to individuals from all sorts of different disciplines. So we're not just talking about those individuals who have the ability to spend $2,000 to fly somewhere to go to a conference and pay for the hotel for multiple days. Just the sheer accessibility of data and information and those collaborative conversations. I think for me, while I'm never going to look back and say, wow, that was an amazing pandemic for all of the reasons that, no, we're not saying that. And anyway, and I am grateful that is something that through necessity, we sort of figured out how to do, and we will continue to hopefully carry that forward and keep those conversations going. So I think for me, looking forward, that's one of the pieces that I'm most excited about, is if I think, well, gosh, I've learned so many things that I didn't even know existed 2 years ago. What else don't I know?
Yeah.
Cool.
A lot.
Right?
Yeah,
Right?
a lot.
Yeah.
Right.
I would say that I am hoping that this is the 12th virtual behavior chat that I've done because of this pandemic, that this is why these emerged, was doing these. And I'm hoping this is a pause, maybe even potentially a permanent pause to these virtual behavior chats, because we are climbing our way out of this pandemic, and I will hopefully be moving to Australia soon. So hopefully that's the silver lining there, as you mentioned, was I would not have done these if it were not for the pandemic, just to offer people something free to attend and learn something new and have all different topics. But yeah, I'm more than happy to pause on doing these for getting out of the pandemic.
Yeah.
That these kind of opportunities are great. And I also think they've opened, I did remote consults before with people that lived in areas that didn't have behaviorists, but we've upped our game with that so much, and even doing a lot more remote sessions with our own clients, especially our cat clients that don't want to, stuff their cat in a carrier, drag it up to the clinic, and then the cat's just, even on gabapentin, terrified and nothing happens. But at the same time, nothing beats going and sitting at a table or at the bar afterwards, to lecture Eddie and chewing the fat over the day's talks. So when you move to Australia, I'm going to come visit you.
Yeah, please do. I want everybody to come visit me. I'm gonna buy like a few dozen yurts or something like that, and everybody can just come hang out.
Right.
Uh, it sounds amazing. I think I just made the case that I'm starting a commune. Um, so maybe not that. But otherwise, yes, please come visit me, anyone and everyone, and I'd be happy to show all the amazing stuff I expect that we'll be able to be doing with Adelaide Zoo and my connections to Melbourne Zoo as well, and all the companion animal and potentially farm animal work so agricultural animal work that we'll be doing. But there's going to be a lot, and my colleagues, tons of amazing work that all the wonderful graduate students that are there now. Susan Hazel, Dr. Susan Hazel, who's has PhD and is a veterinarian and does amazing work and is the main reason why I will be there. So I can't speak enough praise to everything that's going to be happening out there, that's already happening, and that I get to become part of. Amazing. So.
One of the things that I'm really excited to, hearing about all of those things you just mentioned too, it reminds me that there are so many regional differences in either thought process or cultural differences that impact, especially as we're talking about behavior, animal management strategies, and whether we're talking about companion animals or livestock or whatever the species. I think about that, knowing that one of my residents is near Brisbane, on the Gold Coast of Australia. So I will be coming to Australia at some point to see cases in his practice. So we'll see if we can make that work. I'll know that there's a yurt waiting for me if I make it to Adelaide. But anyways, it's fascinating having those conversations where certain cultural perceptions, whether it's the practicality of enrichment, or whether it's just the way in which animals are housed based on climate differences from one country or one region to the next, all of those things matter. And so having the ability to not only practice in our individual communities with our immediate proximate client base, but truly saying, oh, wow, I never thought about how that particular variable may have impacted that particular case. Ooh, that informs what I'm seeing in my own practice as well. So I love that ability to again remain curious about what else don't we know, not just within the physical or the medical, but the cultural and the environmental and the climate-wise, all of that stuff. It can matter. So I look forward to seeing what you start to see when you make that shift to a different area. It's like, well, wait a minute, wow, cool. Let's share it with the world.
I don't know if you know this, but the wildlife is a little different than the Northwest.
Right? It actively tries to kill you in Australia. Like it actively tries to kill you.
That's more the northern part. That's more where you're going. Brisbane, you'll get to see some of the stuff that more actively. Yeah, less so in Adelaide, just a few venomous spiders and snakes.
And great white sharks.
Yeah. Less great whites. I don't know the level of occurrence of the killer great white shark. Certainly not the killer octopi or octopuses. Since those are out in the Great Barrier Reef, the ringed octopus out there that'll you're dying if you get bit, basically.
Adelaide is one of the 3 places in the world where you can do apparently awesome great white shark cage dives, which is on my bucket list.
I did not know that.
Yes.
And guess what I will not be doing?
but you just got your reinforcer to get Laura into a yurt in your backyard in your commune. Right. You can arrange for that tank dive. So there you go.
I have not seen a beach in South Australia yet. I've seen a lot of pictures, especially from colleagues and the like, and I keep getting told how amazing the beaches are out there. But Australia's I have been in love with the wildlife in Australia, the monotremes and the marsupials, since I was probably old enough to speak. I have been fascinated by the wildlife out there. Amazing cetaceans, amazing owls, amazing, and some of the frog mouths and those. I could go on and on about the wildlife there. It's amazing. And I love wombats. Wombats are one of my favorite animals on the planet. They look like somebody bred a hamster with an Ewok. Uh, so they're incredible. They're adorable. I can't speak enough to that. Anyway, sidetracking this with
Yeah.
Australian wildlife, but worth mentioning all these things. So yeah,
Yes.
I will be very interested in some of those regional differences. Sometimes it's shocking some of the stuff that I feel like there's basics of cultural aspects of just animal ownership, animal pet ownership when it comes to, I mean, one of the doctoral students that I'm co-supervising does all her work with domestic cats. And it's the stuff I've had to learn about even what's common practice for people that own cats, let alone dogs.
Yes.
Um, it's shocking some of those differences. Some of the things I've
Yes.
learned about, like in the UK, most domestic cat owners apparently are absolutely opposed to not letting their cat outside. So most cats in the UK are outdoor cats.
Happier.
So, well,
Probably.
there's that's part of the empirical questions involved, and then the effect that has on wildlife and whatnot. These are
Yeah.
all important questions, but also at the welfare level, there's a lot of
Yeah.
stuff that we can't assume. There's actually there's a paper I just read. Is it O'Malley? I think O'Malley was looking at, yes, O'Malley, 2021, looked at some aspects of cat welfare in relation to things like outdoor cats. So, um, and I have to look up the specifics as well, but there was some interesting welfare implications involved for domestic cats. So there's some cool stuff that I'm learning more and more about. But that's O'Malley, I think, was is, and I'm sure I'm getting the reference wrong. I'll put it in the YouTube video. Some of these things I end up reading so much, but there's a cool paper on looking at some of the aspects of outdoor and versus indoor welfare
Yeah.
aspects of domestic cats as part of what they looked at. So yeah.
Yeah, the piece that I love there too is, again, it gives you the opportunity to challenge your assumptions by asking those questions through that scientific lens, almost regardless of discipline, right? Like if you're asking the question to say, well, this is what the indoor cat does. Is it? Is it? Well, what if we change this variable or this one? Then what? Is it something that is inherent? And this kind of brings me all the way back around to one of our early conversations about sort of normal versus abnormal. Well, what does that even mean? Normal for a given set of conditions. When we change the conditions, how does the behavior change? What's visible, what's not visible? And it really requires us as clinicians, as scientists, as trainers, as consultants to really, I think, remain a whole lot more open than many of us, myself included, are generally comfortable being, and really getting comfortable with the I don't know, but wouldn't that be curious? Let's ask some more questions around that. It really opens the door to a lot of possibilities that are, fascinating.
Yeah, but I had to look this up because I couldn't wait. So it is O'Hanley et al. 2021 that I had to take a quick look. But there are some. They looked at things related to aggression in cats. So in relation to, and they found some indications of potential increased aggression uh, correlated with outdoor cats that are going outdoors, as opposed, so opposite of what some people would have predicted, that outdoor cats potentially displayed more aggression than cats that were limited to being indoors. So interesting, one of their findings, but I'll throw that reference to when I put the video up. Um, one thing I was going to note, and we can come back to talking more about data, but we haven't had a lot of questions. There are a few comments here. Laura has been amazing at jumping towards the chat and bringing that up. But people are more than welcome to ask questions, more questions as well. Uh, we've actually successfully talked about at least a little bit all three of our talking points. And I'd like to spend more time, of course, talking about data and incorporating, building that, bridging that gap between behavior analysis and vet behaviorism. But otherwise, if people have any questions. So I guess I'll just mention, in terms of behavioral data and what that means, um, I think that's an important part. That's a step that I'd like to see, uh, that's using at an assessment and intervention level. So those two parts equally well, that along with physiological data that every veterinarian is, of course, trained to pay attention to, right? That's so we're talking about incorporating these understanding behavioral function with the medical model. That part of what that would mean, learning to use behavioral observation and potentially experimental manipulation in a behavior analytic sense. So and what that simply means, let me change this one condition, let me go back, let me run a reversal for this dog, for this cat, for this hamster, for this wombat. Mentioned hamster and I go right to wombat. But we can talk about running things like reversal designs for understanding behavior, looking at aspects of that where we go, you know what? Let's even incorporate that with, we want to use this medication. Let's talk about what changes we see behaviorally and how can we measure that in some way. And I think there's a great practical way for that to be done. I've been spending years trying to figure out the most practical ways and doing a really terrible job of it, but it's getting a little better. So that's the kind of thing that I think is a really where we can see some of the biggest benefits between bridging gaps between behavior analysis and vet behaviorism is, hey, how do I do this in a way that's practical for the owner, for veterinarians, that they can measure behavior? And because every medical professional understands the importance of data, it's just often limited to, well, we don't know what we're doing with behavioral data, but we know tons about how to measure this physiologically.
Yeah, I think it's challenging. I mean, I think that we're probably all of a similar mindset there, that when you're looking at that N of one and looking at individual variables, that I find that a whole lot easier to then say, okay, cool. Now we know what this influence, pulling that lever, making that change, we can now demonstrate based on X, Y, and Z variables what exactly if that effect is. I think that's amazing. And I think, I think, if Valerie and Laura would answer the same thing, that we do that on a regular basis. The place where then I get a little stuck, and we've got a few ideas here, but get stuck is then saying, okay, to what degree does that N of one inform the other 42 dogs or the other 37 cats or the other 29 wombats, in terms of what do we learn, right? Because it is so individual based on their genetics, based on their learning history, based on all of that. So I find it difficult to then take some of the bigger studies and bring them back around and informing the individual recommendation. With that being said, one of the things that I'm really excited about, I mentioned before that I'm personally affiliated and professionally affiliated with Instinct as a company. And as our organization continues to grow, we are looking actively at ways to capture that data at the time of intake and really looking at what are the patterns that tend to be correlated, even just sort of saying what is, again, observe it first. Let's describe what we're seeing, knowing that we're getting data points from all across the country, as well as internationally very, very soon. And so we're looking at some of those patterns to then say, okay, now what? What questions do we want to answer? And when we put certain interventions into play, whether that be training programs or whether that's referrals back to veterinarians or veterinary behaviorists, how does that change what the data looks like at more of a population level? And are there additional patterns that start to emerge that are more significant? So it's, at least through that lens, we are moving in that direction. It is something from a behavioral health standpoint is very much in motion. I'm excited to be a part of that, along with my other vet behavior colleagues. There's 2 other veterinary behaviorists who are affiliated with Instinct at this point in time as well, which is really exciting.
Yeah, I will. So there's a couple, you mentioned a couple points. One of those that are really that I'd like to expand on. And one of those is just, I think part of the solution is as we get more advanced technologically, that's where we're going to start seeing more aspects of this for behavior. Although I will say there's a lot more I could say about that, but we there's some limitations still, but just being able to have those apps, being able an owner on their phone to say, I saw this, and that. Now we have to have detail about what goes into those apps, and also things like what conditions are run. But coming back to the original thing you pointed out about when we talk about internal versus external validity. So that question of, okay, we know how this works for this one dog, but what does that say about 50 other dogs or 5,000 or this breed or dogs in North America? Or now we're getting at external validity. So how much is it generalizable?
Yes.
And the simple answer is, from a clinical standpoint, that doesn't matter. We don't care, right? So if your point to data is, I'm just trying to figure out what's the best treatment for this one dog or cat or wombat, that's then the N of 1 is all you care about. It's just deciding what's the best way to assess and then measure the treatment. So that's all you care about, is that N of 1. And that's where I think behavior analysis has a lot to really offer vet behaviorism, because we have almost a century of data, over half a century of applied behavior analytic data that has guided our ability to use an N of 1 to understand with experimental control what is happening and successfully predict what will occur. So one of the key components of science. So it's great data. We don't have to worry about the generalizable part.
Yeah, um, I think that's an important point, and another area again where we can learn across disciplines, because I know, again, in the model that we're in as veterinary behaviorists, and many graduate student degrees that are not in ABA, to design a research project, you can't go get a research project accepted in a behavior residency if there's one individual in the like, you can't do case reports like they do. It can't be an N1. You have to have X number of dogs or whatever, which then becomes really difficult, because one, it's more time consuming, it costs more, so it limits some of the studies that we can do, where it would be nice if some of the other professions and disciplines could recognize that in some circumstances, doing these research projects where it is just looking at one individual, you can still get important and useful data out of that.
Yeah, I will say, so this difference between within and between subject data, I've often, and within versus between subject design, and I actually use both I'm one of those weird people. It makes me kind of, I've compared within subject methodology to being left-handed, which I happen to be left-handed. The majority of the world is right-handed. And if you are left-handed, you have to learn how to navigate in a right-hander's world.
Yeah.
So people who do within subject methodology who use that, and it's important to make this distinction. This is not just, often people think of within subject methodology as case studies, and case study means a lack of experimental control for the most part, as it's typically operationally defined. Within subject methodology has strong internal validity and is very well, if unless you're discounting the work of Thorndike and Pavlov and Skinner and some of the most important behaviorists ever, who all used exclusively within subject methodology. This has strong experimental control. But we're not even talking about that at the clinical level. So we could talk about that from the research and scientific level. But at the clinical level, we're just saying, how do we know that this treatment was effective? So there should be no doubt. And that's the part that I think if somebody, unfortunately, there's not a great bridge between this. I want to use data to be an effective practitioner, and I need to learn how to do research. Those are not the same thing. Those can be very mutually exclusive. And one can help guide the other, but using data from a practitioner standpoint, as there are many applied behavior analysts that use data and never publish any of, in fact, the vast majority of applied behavior analysts do not publish their research. They simply use data, quantitative data, for practical purposes. And that's where I would like to see, I think, more, uh, it would be nice to see more of that incorporated within vet behavior practice.
Yeah.
Again, I can go on and on. One of my spiels, data. I get on my soapbox about data because I think it's important. But yeah. So I don't know what the answer is for how we get there better. More of this bumbling around in the dark thing. I've been trying to figure some of that out, and I hope that's ends up eventually being part of my legacy, is that in finding ways for practitioners to be able to use more behavioral data. So yeah, that's, well, we effectively covered point number 3.
Yeah, it'll be fun to see where this all comes together. You know, if that happens, and who knows whether it'll happen in you know, any of our careers. Truthfully, you know, if I think back to, you know, gosh, so I got board certified in 2010, so I'm just going on 11 years from that point, 17 within the discipline. But thinking about everything that has changed within that time frame, and how a lot of these disciplines do really pick up momentum as the data changes and evolves and grows and it builds on itself. I'm curious to see where we're going to be in another 5, for that matter, let alone another, you know, 11 to 17. It's going to be fun.
Well, in another 5 years, I hope to be in Australia. That's what that's my only real goal right now.
Fair.
But I'd love to see where the research is, and especially some of this, the collaborations and bridging between different fields. That's also another a prediction that I make. I think that's going to become more common in the future. Is I think it's going to be less common to see these exclusive roles. So somebody is just a professor, or somebody is just a practitioner, or something like that. Because we've seen so much more of that. As you were mentioning, Chris, that you teach at various universities as well. I mean, I'm mostly an academic, but I bounce around through so many different areas, and talking to a lot of practitioners, etc. But I predict in the future we're going to see a lot less of that, the exclusivity of, well, this person's in academia, or this person's in private business, or this person's in, you know, this person's a practitioner, or something like that. We'll see a lot more meshing, more fluidity between those different areas.
I can see a lot of benefit to that.
Yeah. Yeah, I would be more practitioners publishing would be absolutely necessary. I think we need to see more of that as well, and more academics working in the field. Boy, would I love to see that a lot more often. I know a lot of academics that need to step out of their office every now and then. So I guess with all of that, I don't know, any final thoughts? And there's still a little bit of time for any questions, any final questions there, but final thoughts from you all about all of this?
No, I'm just glad that we got to sit and chat and that you have this forum that, you know, you put out for everyone, and it's good to talk to you again.
Same here. I appreciate being invited. It's always nice to just sit and toss a lot of these ideas around. I mean, it's to me, it's what makes the field exciting, is we do have so many questions, although yes, like Laura, sometimes I feel like my head's going to explode, but it's still fun. So I've enjoyed this. Thank you.
Yeah. And until such time that we're able to meet at the hotel bar after the next conferences that we're all able to be at, I'll continue to enjoy these and hope that they do continue, Eddie, as well. I mean, I think there's a huge audience for this type of conversation, even as an idea generator. You know, just like, hey, well, what about, you know, what do we all think about this, that, or the other thing? So I'm excited to see these continue.
Yeah. No, I think we'll have more things like this. I will say what my one disappointment in all of this is, Valerie, we didn't get to talk about exotics as much here. I mean, I mentioned wombats.
Yeah, but you talked about wombats, so I'm pretty happy.
And also, it doesn't have to be the bar that we all meet at in the future. It could be the yurt.
Right.
It could be the yurt. We'll do that. Although I would make the vote. I would rather it be the yurt than the shark cage. Like more power to you, Laura, but I'm not joining you in that shark cage.
You guys can sit on the boat and wait for me to come back up.
Laura, I will give you this. If you're willing to go out towards Canada or the like and hang out in a cage around the polar bears, I'll hang out in the cage with the sharks. So I think that's an equally
That sounds interesting, actually.
It does sound interesting. I didn't know that was an option.
I just have to have acceptably warm clothes.
Yeah. You can get on one of those one of those big trucks and go see the polar bears out in Canada.
That would actually be cool.
Yeah. It's actually probably safer than the shark cage. Just to, I
don't
know. I hear a lot of stuff about polar bears. It's like
less room for error than when you are underwater.
This is my only exotic comment along those lines, or for where I wanted something worth talking about. Polar bears are the only of the 50 plus species I've worked with. Polar bears are the only one of that species that has regularly given me nightmares.
Because of their behavior problems, or just their behavior in general?
Because there is no doubt that they want to eat you or are willing to eat you. Every polar bear I've met, I've had no doubt it would eat the vast majority of the people that they came into contact with, and do it in as methodical of a serial killer way as could possibly be possible. They are amazing, and probably they're the animal most people should be the most scared of.
Top of the chain predators.
Yeah,
absolutely. Yeah,
we've covered a lot of ground today. Now we've broadened it to include the serial killer analogy. So I'll call it a successful conversation. Sure.
All right. Well, with that in mind, we'll hang out, I guess, for a second here, and everybody else, thank you for showing up. And I'm going to start. I'm going to go ahead and end the video, and then thank you for everyone who is watching this online. This will be for those here who want to see any parts of it, it'll be available in a few days. If you're seeing this online, it's already happened, but thank you for watching the video.
Yeah. Thanks, everyone.
Yeah.
Bye-bye.